To be performing Goni and MMT of the knee. So to test knee flexion for Goni, you would put the fulcrum on the lateral aspect of the lateral epicondyle of the knee. The stationary arm is going to be on the lateral midline of the femur, and the proximal arm, the distal arm is going to be on the lateral aspect of the fibula. You could use the greater troch for the proximal arm for reference, and the fibular head and the lateral malleolus for the reference for the distal. And normal range of motion is 135 degrees. So end feel should be firm or soft due to muscle or belly fat. So first we're going to just flex the knee, test range of motion and end feel. And then once we get there, you could just bring the patient right into flexion right away and just measure them there. And we got 136 degrees of range of motion. And since the patient is already in supine, we could test the MMT for the knee. So so you'd have the patient lie prone. Sorry, would you please lay on your stomach, sir? To test MMT for the knee, you'd have the patient in prone, and then we'll test for knee extension. But before we do that, for knee flexion, you'll bring the patient to less than 90 degrees of knee flexion, and then to test this, you could just ask the patient to just bring their leg up towards the ceiling. Yep, bring it towards your buttocks, please. Yep, perfect. That's for grade 3. And then you could have grade 4 and 5 with resistance, moderate, and maximum. But there's also isolations for the semimembranosus and tendinosus. You'd go into medial rotation and lateral rotation for the femoris quadratus femoris muscle. So you bring it here, and to test all three, you'd bring it to 90. To test any of the isolations, you bring it less to than 90, and you could stabilize here or underneath depending on the patient. And to do an isolation, if you want to go medial, you bring the toes in, and then as the patient, please try and flex. That's for the medial. And then for the lateral, they'll bring their toes out, and you'll test the same thing to test the other. And then for all three, you put it into 90, and then you'll test all three with mod and max resistance that way. For 2 and 1, they'll be side lying. So if you want to just quickly lay on the side, ideally you'd be behind them, but for time and video, you'd be behind them, supporting the leg, and then you'll ask them to flex their knee like so. That's for grade 2. Thank you. And then for grade 1, you would have the patient laying on their stomach, and you be looking for a trace somewhere around here at the hamstrings. For knee extension, for Goni, the patient is lying and prone. You're using the same. The patient is lying on their back, and it's the exact same landmarks for Goni for knee extension. Range of motion should be about 10 degrees, give or take, depending if they have hyperextension. Same landmarks. End feel is firm. And to test for the hip extension MMT. Huh?
Under the foot.
Under the foot?
Something under the foot. You need something under the foot.
Oh. You could use a towel or a mat or something to try and stabilize the foot under the ankle, so it's at a perfect degree. So if there's any hyperextension, it'll be more noticeable, and then you align it, and then you could test the range of motion of the knee. For MMT, knee extension, patient is going to be most likely sitting. So as the patient is sitting, just please straighten out your leg. That's for grade 3. Grade 4 and 5, you want to make sure that the kneecap is unlocked before you're putting any resistance, just like the elbow. So bring it all the way, like lock your knee, and then just unlock it slightly. And you could provide resistance distally at the ankle for a 4 and 5. And then if they fail that, you go straight into side lying, please, to test the muscle. You could again, you'll be behind them, you'll be supporting their leg, making sure that you have full control of the leg, and then you're just going to ask them to try and straighten it out. And if they can't do that, and then we go to a 1 and 0. For 1, it'll be a trace, and they'll be on their stomach, right?
Back.
On their it is back. Sorry, can you please get it back? Sorry. So they're on their back. My apologies, and you'll be palpating just distally at the femur, where like right before the patella, to palpate the quad muscle to see if there's any activation. 0 would be nothing due to paralysis. Thank you very much.